I'm Yolanda Vasquez, and welcome to Comcast Newsmakers. I am joined now in the studio by Dr. Howard Garrison. He is the Director of Public Affairs for the Federation of American Societies for Experimental Biology. It's a pleasure to have you here, Howard.
It's a pleasure to be here, Yolanda.
So let's talk a little bit about your organization, who you are, and what you do.
All right. Well, the Federation of American Societies for Experimental Biology is a group of 26 independent organizations who have banded together to promote the research and education in biomedical sciences. So I represent organizations of scientists working in industry, working in universities, working in medical schools across the nation.
And one of the issues that you're most concerned about has to do with federal funding. We were talking earlier about how it's fallen flat, but actually you said that it's dipped a little lower. Talk to me about the numbers when it comes to funding biomedical research.
All right, thank you. Well, biomedical research is largely funded from the National Institutes of Health. And the National Institutes of Health has not really seen any increases in funding since 2003. Now, over that 10-year period, the opportunities for research, the opportunities to make discoveries have increased tremendously. But funding has been pretty much flat up until last year. And last year, as a result of many factors beyond our control, funding was cut by more than 5%. So as a result of increasing costs, increasing sophistication of research, and actual cuts to the NIH budget, we are now funding 1/3 as many grants to scientists as we were 10 years ago.
But in all fairness, would you say that other programs have been cut as well with funding, or not to the extent it has with FASEB?
Well, funding for many areas of research has been cut. Funding for education has been cut at the state and local level. So what we're seeing is a contraction of a research system that was the envy of the world. People come from all over the world to study, to do research here, to learn how we have managed to build such a research powerhouse. And now, instead of emulating us, other nations are beginning to overtake us.
And the interesting thing is you said that other countries are doing more funding when it comes to biomedical research, so you have a lot of people from the U.S. that may be going elsewhere. I mean, we're losing our good people.
Right now we're watching other nations rapidly increase the amount of money that they are putting into biomedical research. And the discoveries that would have been made by American scientists may be made by scientists in other nations in the future. The industries that will grow up around those discoveries may not be centered in the United States.
I'm going to talk about the long-term impact in a second, but tell me a little bit about biomedical research. Exactly what is that? It touches upon so many different things.
Well, it runs the gamut from the most basic fundamental research about cells through the research on health and disease. And so my societies represent researchers doing everything from fundamental biochemistry through clinical research on a vast number of diseases, including Parkinson's disease, cancer, and diabetes.
We've got about 10 seconds left. Long-term effects of this funding cuts.
The long-term effects, I think the ones I'm most concerned about is inspiring the scientist of the future. It takes a long time to train to become a scientist, and if the young people of today do not see prospects for creativity and for success in research in the future, they'll go into other avenues and we will lose the talent that we so desperately need.
Optimistic? Is the glass half full or half empty moving forward?
Well, we still have a chance to make it half full,
okay,
and that's what we're trying to do.
Excellent. Thank you so very much. Dr. Howard Garrison, we really appreciate your time.
Thank you very much for having me.
Thank you so much. And that'll do it for this edition of Comcast Newsmakers. I'm Yolanda Vasquez. Thanks for watching, everybody. See you again real soon.